Hello, my name is Jessica. I'm going to be doing an abdominal exam on you today, okay?
Okay.
I've already identified the patient with his name and date of birth. I've washed my hands. So I'm just going to put some gloves on. And I'm going to start with inspection. So I'm just going to inspect his abdomen. I'm going to lift your shirt just a little bit. And his abdomen is symmetric, round, and there's no visible abnormal findings. Okay. Next, I'm going to auscultate. So I'm going to listen to your lung sounds.
Okay.
When you feel the stethoscope on your chest, I want you to take a deep breath, okay?
Okay.
Very good. I'm going to listen to your lung sounds in the back, so if you could face the wall for the video. And then again, when you feel the stethoscope, just take a deep breath, okay?
Okay.
Very good. Lung sounds are clear to auscultation. Next, I'm going to listen to your heart sounds, so if you can face forward.
Mm-hmm.
I'm going to listen to the aortic, pulmonic, herbs, tricuspid, and mitral. Okay. Normal S1, S2, no extra heart sounds noted. Next, I'm going to listen to his bowel sounds, so if you can please lay on the bed for this part of the exam. And I'm going to start with his right lower quadrant, and I'm going to go clockwise. I'm going to lift your shirt a little bit, okay? Okay. Normal active bowel sounds times 4 quadrants. Next, I'm going to listen to your arteries. I'm going to start with the abdominal aorta, and I'm looking for bruits with the bell of the stethoscope. No bruit noted. And into the right renal artery. Left renal artery. The left iliac artery. And the right iliac artery. And again, no bruits noted. I would also listen to his femoral arteries. And now I'm going to listen to your organs. I'm just going to listen to your liver and your spleen. No friction rubs noted. So now I'm going to percuss your abdomen, so you're going to feel me tapping on your abdomen, okay?
Mm-hmm.
I'm going to lift your shirt. All areas are generally tympanic. Next, I'm going to percuss his spleen. Spleen is tympanic. Next, I will percuss the liver span. So, in order to do this, I would percuss above the superior border of the liver, downward, and then below the inferior border of the liver, upward. And I would, at the midclavicular line, and then I would assess for the shift from tympani to dullness. So I'm going to percuss. Okay. So his liver span is about 8 centimeters, and normal is 6 to 12. So that's good. Next, I'm going to percuss for CVA tenderness. So I'm gonna touch your back. So if you can sit on the chair for this part, and then face that wall, okay? And let me know if you feel any pain. Any pain?
No pain.
Okay, so no CVA tenderness noted. Next I'm going to palpate, so again, for if you could just lay on the bed for this part of the exam. And we're going to start with light palpation. And again, I'm going to start in the right lower quadrant, and I'm going to go clockwise, so let me know if you feel any pain, okay?
Okay.
Any pain?
No pain.
Okay. And now I'm going to do deep palpation, so you're going to feel 2 of my hands, okay?
Okay.
And let me know if you feel any pain. Any pain?
No pain.
So no tenderness noted, no masses noted, and there was no guarding or distension. Next, I'm going to palpate your aorta to measure the width. Okay. And his is about 2 centimeters, and it should be 3 or less, so that's normal. Next, I'm going to palpate the edge of your liver. Okay, and it's 1 centimeter below the right costal margin. Okay. Next, I'm going to palpate the kidneys. Kidneys are not palpable. The spleen is not palpable. And then the bladder. And the bladder is not palpable, and it's not distended. So for an abdominal exam, you'd also perform a series of tests. You can do the McBurney sign. So for the McBurney sign, you would need to find the McBurney's point. And the McBurney's point is 2/3 the distance from the right anterior superior iliac spine to the umbilicus. So it would be like right here in the right lower quadrant, and this is to assess for appendicitis. So if I push down and he has any pain, then that would be a positive McBurney sign, indicative of appendicitis. So I'm going to push down and let me know if you have any pain.
Okay.
Any pain?
No pain.
Okay. So negative McBurney sign. Another sign to test for appendicitis is the Rovsing sign. And the way to examine the Rovsing sign is to palpate deeply on the left lower quadrant. And if he has any rebound tenderness in the right lower quadrant, then that would be a positive Rovsing sign, indicative of appendicitis. So I'm going to palpate, I'm going to touch your abdomen here on the left side. And when I release, let me know if you have any pain on the right side.
Okay. No pain.
Okay. So that would be a negative Rovsing sign. Another exam would be the Murphy sign, and the Murphy sign is to examine for cholecystitis. So the way to do that is I would palpate the gallbladder area in the right upper quadrant, and I'd ask him to take a deep breath as I push down, And if he has any pain or any cessation of inhalation, then that would be a positive sign indicative of cholecystitis. So I'm going to push down and let me know if you have any pain, okay?
Mm-hmm.
Any pain?
No pain.
Okay, so that's a negative Murphy sign. And that concludes the abdominal examination.